Hi, welcome to another episode of Youth Diary. Cancer begins in our cell, which are the building blocks of our body. Today we are going to discuss about the gynecologic cancers. And to help us, we have Dr. Manoj Bapu with us. He is a gynecologic oncologist at Kinder Hospital, Cherthala. Hello doctor, welcome to our show. Doctor, can you just explain what is a gynecological cancer?
Gynecological cancer includes all tumors which involve the female genital organ. That means the uterus or the womb where the baby grows, then the lower part of the uterus or the neck of the womb that we call medically as cervix, then the ovaries where the eggs are formed, and finally the tubes which connect the ovary with the tube, I mean the uterus. And also rarely we get cancers of the birth canal, that is the vagina, and also the external genital organ, that is the vulva. But the common ones, as I have told, it's the uterus, the cervix and the ovaries.
We'll go to the questions.
All right.
Hello ma'am, I'm Gayatri Vijay Kumar, second year MBBS student from CMC Kochi. My question is, what is the chance of getting gynecological cancers? Is it related to lifestyle?
Okay, gynecological cancers are very much related to lifestyle, even though that contributes only to a minority, because the main factor is genetic and environmental factors. So to coming to the lifestyle factors, one is the overweight. So those who are overweight have roughly around say 10 times more risk than those who are of normal weight to get cancer of the womb or the uterus. Similarly, say if you have a healthy sexual life, your chance of getting cervical cancer comes down drastically, because 99% of the cervical cancer of the neck of the womb is caused by a virus which is transmitted sexually. Then comes the importance of dietary factors, like you should have a healthy diet rich in vegetables, fruits, and you should have regular exercise, as I have told earlier, to maintain a good weight. Also, it's important to have a regular checkup with your doctor and do a pap smear. That is one test which is quite reliable in detecting cancer of the cervix even before it starts. So that's important. And finally, it's important to get vaccinated as well. So that is something which can prevent this infection, as I have told earlier. Then many other cancers of the like the ovary and all are not much related to your lifestyle. And finally, having children, that's very important. Like have your children at a young age, like say in the 20s before you cross 30s. If you complete childbirth and have 2 children or 3, you lower your risk of chance of getting gynecological cancers. And also it's important that you breastfeed your babies. So these are the steps probably you can take.
Doctor, how do they present? Symptoms.
Symptoms. Yes, ovarian cancer is something which I would like to tell. It is present with all non-specific symptoms. So that is something which you cannot. So any change in your day-to-day change in your tummy, any new pain which lasts for more than 2 weeks, or any abnormal bleeding which lasts for more than 2 weeks, or change in your bowel or bladder habits, you have to report your doctor. And about cervical cancer of the neck of the womb, it presents with bleeding, especially after sex. As I have told, these symptoms again will present only at a later stage. So screening is very important. Early detection is more important than mainly it's abnormal bleeding.
Okay, Dr. Ipam, you have told about pap smear.
Yes.
How frequently do we have to go for that?
Pap smear, the present recommendation is to start at the age of 21 and do it every 3 years till you are 30, and thereafter every 5 years till the age of 65. When we put it in the Indian situation, like even if you do it every 5 years, that will be fine.
That is
it's arbitrarily taken as 21. Once you become sexually active, it is recommended to go for pap smears.
Okay.
Yes.
Okay, doctor, we'll see the questions.
My name is Fatima Salim and I'm from CMC Kochi. And my question is, one of my classmates is having a tumor in the ovary, and as advice for surgery. And is it a cancer? And can she have children in future?
When you told your classmate, I presume that she is not married. So any tumor or any lump on the ovaries, say if it's more than about 8 centimeter, or if it has lot of solid areas when you do scan, or if there are thick septae, or if the scan shows that it has abnormally increased blood flow, generally it is good to go for surgery. And surgery doesn't mean that taking away the reproductive capacity. Most of the time, the type of cancers which are, I'm not telling that this is your friend is having cancer. Even if it is cancer, at your age, what we get is a special kind of cancer known as germ cell cancers, and they are quite well treatable and curable. Like most often, we can get away by removing only the ovaries or part of the ovaries. Only on one side, and you need not remove the other ovary tube as well as the uterus. So in that way the fertility can be preserved, and even if it is cancer, as I have told, you can give chemotherapy after the surgery, and they can as well have children, as I mentioned.
Other than this surgery, is there any medical treatment for?
Surgery is the first line of treatment in these situations, because directly going for a medical treatment or chemotherapy is not recommended. First of all, you don't have a diagnosis unless you do surgery, and for ovarian cancer, always once you do surgery, you are removing the tumor, and also you are doing a staging to see whether it has spread to any other areas. And most of the time, if it's a well localized tumor within the ovary, you don't need to go for any further chemotherapy. And in such situation, you will be over treating them by giving chemotherapy, of course, which does have side effects. So chemotherapy is only as and when required. Like
how long we have to go for a chemotherapy?
Generally, it's for usually 6 cycles, but it varies from depending upon the type of cancer, the individual's stage of the disease, and the response to treatment. Sometimes even if you plan for 3 cycles or 6 cycles, if we see that the patient is responding with 2 or 3 cycles, we may have to switch to another type. So it's variable.
Okay, doctor, does it run in families?
Ovarian cancer, yes, it does run in families. Roughly 10%. That is, 1 in 10 cases of ovarian cancer is familial or it's inherited. And those are the ones which are found in much younger age group, and especially those who have close family, first degree family relatives like your mother, sister, father or brother, like those. If more than 2 of them have either breast or ovarian cancer, you need to check for, you need to go for gene testing to detect whether you have any abnormal genes.